Okay.
Hi, my name is Dondra Face, and I'm going to do an examination of the cranial nerves. Um, Here's my patient. We're going to take a rotation of the room. We're going to look at the table and see my objects. We have my pen light. We have a tuning fork. We have a short dull object. We have the ophthalmoscope. We have a hammer. We have two tongue blades. Have some alcohol pad, and we have sugar. Okay. Hi, my name is Sandra Face, and I want to do an exam on you. Is that okay if I do an exam on you?
Yes.
Okay. We're going to start off by doing the 12 cranial nerve. Well, the examination is going to include the 12 cranial nerves, and they're going to be examinations of each cranial nerve. Okay.
Okay.
We're going to start off with cranial nerve number 1, which is the olfactory. I got a brain cramp. The cranial nerve number 1 is the olfactory nerve. I'm going to have you close your eyes, and I'm going to go ahead on and open up this alcohol pad, and I'm going to have you to cover one there and take a sniff. What do you smell?
Alcohol.
Okay, switch nares. What do you smell?
Alcohol.
Okay. All right. From that, she has smell on both sides of her nerves, so that shows that the cranial nerve number 1, which is the olfactory nerve, is intact. Cranial nerve number 2 is going to be the optic nerve. What the optic nerve is a specialized sensory nerve. We're going to do 3 different tests for that. The first test is going to be the Snellen chart, which we're going to have you do. The next one is going to be the visual fields chart, and then the third one is going to be a fundoscopic exam. I'm going to have you stand up, and from there we're going to look at the Snellen's chart. Usually you'll be 20 feet away, but we're in the room and everything, so I'm going to have you cover one eye, and I need you to read the line above the red line.
EDFCZE.
Okay, can you read the line below the red line?
FELOPZD.
Okay, can you read the line that's below that?
No.
Okay, switch eyes. Blink a few times so you can get them together. All right, can you read the line above the red line?
EDFZOD.
Okay, and can you read the line that's below that?
FELOZED.
Okay. All right, have a seat. Your left eye is 20/30, and your right eye is 20/25. Okay, now we're going to go ahead and do the visual fields test. I'm going to have you to close one eye and put your hand over one eye. I'm going to close the same eye as you. You're going to look straight at me. I'm going to put my fingers just out of your reach in the peripheral vision, and I'm going to want you to tell me when you see them, okay?
Okay.
You see my fingers?
Yes.
You see my fingers?
Yes.
See my fingers?
Yes.
See my fingers?
Yes.
See my fingers.
Yes.
Okay, switch eyes. See my fingers?
Yes.
See my fingers?
Yes.
See my fingers?
Yes.
See my fingers?
Yes.
Okay. All right. Next, we're going to do the fundoscopic exam. The light is shining in my hand. I'm going to dim the lights down. Look straight ahead. There's a picture above my shoulders. Look straight at that picture. Okay, what am I seeing? I'm seeing the red reflex that's showing off of her eyes. Okay. Again, I'm seeing a red reflex that's showing off of her eyes. And that should show up in the orange color. I'm also seeing the optic nerve. The optic disc should be round, should be like a yellowish orange color, and it should be at least half of the size of it, and that shows that it's a good optic nerve. If she didn't have a red reflex that was missing would show that she did not have that she had cataracts. But because she has a good red reflex, it doesn't show that she has cataracts or anything like that. As far as the optic disc, it should be, it was round and everything. So, and it did show a little orangeness to it. The next one we're going to do is the oculomotor, the trochlear, and the abducent, which is cranial nerve number 3 is the oculomotor, nerve number 4 is the trochlear, and the cranial nerve number 6 is the abducent. And with that, we're going to go ahead on and do the pupils. Let's do the pupils. We're going to make sure that the pupils are equal, round, reactive to light, and accommodation. I'm going to go ahead on and take and have you look straight ahead, and the pupils are reacting. Okay. I'm going to shine the light on her nose, and the pupils are reacting at the same way. Okay, next we're going to do the 6 cardinal signs of gaze. I'm going to have you to look straight ahead, head straight, and only follow the object with your eyes, okay?
Okay.
Okay, we got that. So after that, her pupils was round reactive. Her pupils were round reactive. Her pupils were equal, round reactive to light, and I forgot accommodation. I'm going to take you and have you look at this object again. Okay, her eyes was crossing, so that is accommodation. With that, next cranial nerve, which is a sensory nerve, will be the trigeminal nerve is a sensory motor nerve, and with that, I'm going to test her sensations in the trigeminal area. I need you to have your hand. You feel that?
Yes.
You feel sharp or dull?
Sharp.
Okay. What about that?
Dull.
Okay. What I'm going to have you do is close your eyes, because I need you to tell me if you feel a sharp or a dull sensation. Okay.
Okay. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay. You can open your eyes. I will also do the corneal reflex, and I'm not going to do it, but I'm going to talk about it. And what that is that I would take a wisp of cotton and brush against her cornea, and it should blink. Next, we're going to go ahead on and do the motor part. I want you to go ahead on and to clench your jaws. Okay, do it again. Okay, do it again. Okay, all right. I'm feeling for her muscles and everything, and the muscles are equal in strength, and I don't feel one weaker than the other or anything like that. So we have that out of the way. Next, we're going to do, we did cranial nerve number 1, we did cranial nerve number 2. Cranial nerve number 1 was olfactory, cranial nerve number 2 was optic, cranial nerve number 3 was oculomotor, cranial nerve number 4 was trochlear, cranial nerve number 6 was abducent, cranial nerve number 5 is what we're going to do next. No, cranial nerve number 5 was trigeminal. Cranial nerve number 7 is what we're going to do next, and that is the facial muscles, and that is the sensory motor. And what I'm going to have you to do is move your face. Not move your face, that don't sound right. I'm going to have you move your facial muscles, and with that, I'm going to have you do a smile. Okay, open your eyes, close them. I'm going to have you to show your teeth. Okay, all right, that's all you have to do with that. And we're going to do the taste part. I'm going to have you stick out your tongue. Stick out your tongue. And I'm going to go to the anterior 2/3 of your mouth. And I'm going to place this item on your tongue. Tell me, what do you taste?
Sugar.
Okay, that is correct. That was sugar that I put on your tongue. Um, Also, if I had to do you puff out your cheeks. Puff out your cheeks. Okay. All right. We're gonna move on to cranial nerve number 8, which is a sensory nerve, is the acoustic um, nerve. What I'm gonna do is I'm going to go ahead on and I'm gonna ping my tuning fork, and I'm gonna take and put one behind your ear. That's the mastoid muscle, mastoid bone, and then I'm going to put it in your ear, by your ear. Tell me which one you hear the loudest, and then I'm going to take it and tune it again and put it on top of your head. And I need you to tell me if it's on the left side, the right side, or both ears. Okay?
Okay. In the ear. Behind the ear.
Ouch.
The right side.
Okay.
Right ear.
Okay. And what that tells is that she said that it was behind the ear on one, so that meant that bone was louder than ear. That means she has a potential conductive problem in that ear. We want ear to be greater than bone, and that's a normal result. Result. She said that her ear, when I had it on top of her head, that was the Weber's test. The Ryan's test. I'm sorry, I need to back up. The Ryan's test is when I did the conduction behind the ear and on the ear. That was the Ryan's test. The Weber's test is a test when I put on top of her head, and she said that she felt it more on the right side.
Right side.
Right side. That means she had some sensory neural deafness going on. So she has some ear issues that maybe needs to be further examined by an audiologist or something like that. The next one is going to be the cranial nerve number 9, which is glossopharyngeal nerve. Glossopharyngeal nerve, we're going to do motor and sensory. I'm going to take and put some of this substance on the posterior. Stick your tongue out. Posterior 1/3 of her tongue, and tell me what you smell. What do you taste?
Sugar.
Okay. I'm going to take and shine my light. We're going to have you stick your tongue out, and I'm going to have you say ah. Okay, how you feel it did move up and down, and then I would do it again and do stick your tongue out, and I would do the gag reflex. Okay, cranial nerve number 10 is the vagus nerve. Usually you do cranial nerve number 9 and number 10 together. And with that, I did the uvula test. I did the gag reflex. I used the tongue with the tongue depressor so I could see everything. Swallow for me, please. Okay. Next is the cranial nerve number 11. Cranial nerve number 11 is the spinal accessory nerve. What I'm going to do with that, I'm going to have you to shrug your shoulders. Okay. All right. And I'm going to have you turn your head to the right and push against my hand. Okay. Turn your head to the left and push your head back to the center. Okay. She's had equal strength in both sides. When she was shrugging, I didn't feel any abnormal strength there, and when she pushed her head from side to side, I didn't feel anything different in there. So that means she has a 5 out of 5 on that. And if it was any type of one was stronger than the other, I will have to note the weakness on the side and have her further investigated for that. The last one is cranial nerve number 12, which is a motor nerve, is the tongue. I have you stick your tongue out. Okay, put your tongue back in. I will go and have you put your tongue on the right side, left side. And that is it. I feel as though I forgot something. I'm not sure if I did it. I can't remember. I'm going to go back to the trigeminal nerve. I'm going to go ahead and have you clench your jaws. Okay. And clench again. Okay. Move your jaw from side to side. Your jaw. Okay. All right. That's enough. I think that is all. I want to thank you for being my patient, and it was a pleasure.
Thank you.
That concludes my examination. Again, my name is Dondra Faison, and I will turn this into exam.